Thank you and good evening to everyone. We had a fascinating afternoon session of excellent lectures. I mean, we had in our midst professor of psychology, community pediatrician with a lot of community experience, consultant child and adolescent psychiatrist, and two special educators and authors with a completely different dimension and different view to the whole problems of autism. So without much ado, let's begin the question answer session. The first question is from the audience to Dr. Saha, Dr. Asoke Saha. Can you share your experience about the challenges you face while spreading awareness about mental disorders and mental health in your country? Nakita. Can you share your experience about the challenges you face while spreading awareness about mental disorders, mental health in your country?
Thank you very much for the question. But earlier there is a problem and stigma in our society, but right now in Bangladesh, because of the new intervention taken for autism, to combat autism and their sufferings, so nowadays is increasing awareness. So we don't have any problem for the health workers and community workers to work with autism and mental health.
Right. So challenges in terms of stigma, challenges, I mean, any specific challenges with regards to, you did mention in your lecture about, there has been a lot of, there has been changes which has happened and a lot of incentive has come from the government as well. But even then, in spite of that, what are the major hurdles that you still face with regards to dealing with these community models? I think that was the question.
Actually, earlier there is a problem, but right now there are a lot of foreign NGOs and international NGOs and NGOs in Bangladesh and health workers and community clinics are working. So there is no such problem nowadays. Okay. So there is a tremendous change is taking place now.
Right, right. That is very encouraging. The next question is to Dr. Gauri Divan. What, according to you, is the greatest obstacle while training parents to work with their kids in the past model, perhaps?
So actually, the challenge is not with the parent. The challenge is with the community health worker because they have no experience of autism. So I think parents are really their child's experts. So we set them on a path of reflective thinking, looking at their own videos, and it takes a couple of maybe sessions because sometimes mothers are not so comfortable being in front of camera or watching themselves play, or they don't know what to do with toys. Sometimes, particularly when the kids are older, we've talked about, many people have mentioned the idea of mimicry and learning, but many of these kids don't play with others, so parents don't play with them. So I think that was probably a little bit of a difficulty, and sometimes parents don't know how to start play. But once we set our strategies in place, and I showed you some of those, which is just copying the child or mirroring what they're doing, parents have not been particularly a challenge. I think the challenge is more about upping the knowledge and skill level of the community health worker.
Right. And I think as an extension to that question, what is the major difference with regards to family-based interventions when comparing India to other countries, in your opinion? Comparing India to other countries.
And comparing family-based.
Yeah. Family-based interventions.
So I can't say that I have that much experience with family-based interventions. We really work, we work with the parent, so it's a parent-mediated intervention. We don't work with other, so we always have the family elect one member who gets the treatment or gets the intervention. One of the challenges for us was often when you have both parents sitting, it does create a little bit of stress because you have somebody informing the other person what they should be doing or not be doing. So we've been very clear, particularly that's something which is much more complex, which a skilled therapist can handle, but not a community health worker. But I really cannot comment on the difference between family therapies in India or abroad. That's not my area of kind of expertise.
I mean, on a broader level, this is my question really. So how do you perhaps handle the expressed emotion, or maybe the difference between, as you mentioned about if two parents come for therapy and they have a difference in opinion with regards to how to deal with the kid. So how would you resolve their interpersonal conflict?
So I think that is, pretty, I think that's well established. And so first of all, it's not part of the pass intervention, but that's something that you handle separately. I think the approaches are always to try and understand both points of view and where they come from, and then try to get the parents themselves to find a common bridge. So I think the way we work is always, let's get the solutions from the family. Because they are the more tenable solutions. Those are solutions that they're going to be adopting in the future. So really, what is the conflict about? And the conflicts are often not the child, they're more complex situations within a family setting. And I'm sure Kavita probably has more experience with this too, is that, the whole having a child who is different is a kind of stress on multiple levels. Particularly in the Indian context where you have joint families, you have expectations, you have many other things going on. So I think sometimes just bringing people into a room to be able to express what is their concern, where that concern comes from, and really thinking of their own solutions are probably the best solutions going forward.
Right. Would you like to add anything?
I think I agree with Gauri. So the way we work with that usually is to connect them to a common goal. And to accept and validate the fact that everybody will have different opinions. And that's true for any child. It's not just a child with autism. A father may think very differently and a mother may think very differently about the child, and that's all right. And we've had families with the grandparents also coming in, which is fine. This is how we live. And if we can all unite towards a common goal, because usually, and not even usually, I think all the time, their intention is to help the child. And if we can unite in that common intention, usually they can find a way. And I agree with Gauri that most of the times the solution forward comes from within the family.
Yeah. So I think that's very important. If you can communicate that everyone is working for the betterment of the child. So the child's best interest is the main concern of professionals.
I think
as well
just
as family.
gathering the intention of everyone in that room,
Right.
being able to say, yes, we want things to be better for the child, sometimes is the way to find a way forward. Because the methods each person has may be very different, but intentions usually are to help the child.
Okay, thanks. And the next question is for you. Is the Smart Connect model only effective when started early?
If you're looking at it from an evidence-based point of view, we don't know yet. We are starting 0 to 6. We're using the same model in the older children as well. But the disclaimer that I would like to put out there is there is no randomized controlled trial for us to yet say this is better or that is better. I'm presenting the experience that we have and the model that we have developed. No way for me to say whether it is going to work in the older children. I don't see any reason why not, because it's not exclusive to age. It is a philosophy and a model and a set of principles. I don't see why not.
Yeah.
But I do think it's
But
more,
you have
most
experience with
effective,
the
in
early intervention
years.
model.
Yeah.
Right. Okay. Question for Tali. I think you have answered it in your already, but still, I think just this is the question which has come. What are the activities that could be conducted with kids on the spectrum to build self-esteem?
I mean, this is something that I think was sort of touched upon in
Yeah.
the presentation, not about specific activities that would work well for all kids in developing self-esteem, but to identify what's motivating for each child, to identify what each child's strength is, and to cultivate those activities. That's the thing that's going to really build self-esteem, is seeing that a child's interest is validated, that what they want, what they like, and what they're good at is valued enough to have an activity designed around that activity. So I think that's the thinking about what activity is going to be most targeted for that child is a thinking that we need to have. But I will add that I think also activities that are designed around independence and life skills can really help develop self-esteem. So whether it be cooking in the kitchen, making your own smoothies, making your own salads, putting away the groceries, those kind of activities that can really help give a child a sense of contribution and independence can definitely contribute to emotional well-being.
Yeah, so you have structured it into 7 points, isn't it? Like how to build it up. So would there be a structure to that, or it would be very person-centered? Like, which would be more appropriate for which kid or which family? So would it be like,
You mean of the,
yes,
of the 7,
yes,
are they
yes,
sequential?
yeah.
Not necessarily, except the first one I think needs to come first, which was changing your goal, changing your question, which is your approach, and how you're approaching a child, what your goal is to help them bring their unique self to the world around them versus trying to close the gap and make them more like other kids. I think it has to all start from there. But that's why at the end I asked what strategy you're taking away, because I think for any parent, any professional who's listening, to see what resonates with them, where can I really grow as a parent or as a professional, and really implement that. And it could be speaking to your child's true intelligence. It could be cultivating their true strengths. And then once you get a hang of what that feels like, then adding on the next one. So I don't think it has to be in a particular order, but I think each one is a really important piece.
I think as professionals, I mean, when we work in this field, we often have to kind of reinforce that on and on and on with regards to, as you mentioned about the strengths, as well as that your child, you cannot compare it with some other kid, say a 10-year-old child on the spectrum. You cannot compare with the 10-year-old child outside the spectrum. It's best that you know how far he has progressed over the last 6 months or 1 year. So that would be a marker with regards to that he is improving. He's taking strides.
That's right. And I'll just add, having 3 kids myself who are neurotypical, even though they have their own little challenges, but that's true for all kids. That's true for all people, is not thinking about how can my 12-year-old be like another 12-year-old, but how can he be his best self? And whatever support, whatever guidance, whatever path I can provide that will help him more fully actualize his own potential.
This question is for Beth. Let me first understand the question myself. Functional medicine practitioners, how do we find someone who is accredited or reliable?
So it's a great question because I think the field of functional medicine is relatively new, although some of the principles of functional medicine have been around for thousands of years. So the principles of functional medicine are kind of looking at underlying causes, looking at root causes rather than just to address or suppress symptoms. So you may find that kind of approach is a systems approach, and you may find that in traditional Chinese medicine, Ayurveda, and other kinds of traditional medicines, that perspective. However, functional medicine doctors are those that have typically been trained at the Institute of Functional Medicine, is one body, professional body in the United States. They now have a clinic associated with Cleveland Clinic. So what you see is a lot of practitioners who are coming from all over the world. They're flying to the United States to be trained in functional medicine, and they're taking those principles back to their own clinics and practices. And they have a website where you can go. I think it's IFM. I'm not sure what it is. It's institutional. Institution of Functional Medicine, it might be ifm.org, they have a provider directory, so you can go on and see if there's somebody in your geography. And I don't know how many practitioners are trained in India. However, concurrent to this weekend, there is a functional medicine conference in Delhi right now.
Okay.
So you might want to Google that if somebody's interested.
Right. Any more questions from the audience? Those who didn't get the chance to get into the website, or anything arising out of the discussions over here? Yes, please.
She had asked me a question earlier that I said I would.
Okay. Right. Yeah, sure. Can you repeat the question? I think it will be easier for others too. Do you have a mic?
Good, I'm glad you stayed. I was looking for you.
Not working? Yes. So my question again, to repeat it, is that my son, he does his maths, English, geography, science, whatever. He's 10 now, and he goes to class 3. He does his level, whatever the level that is for a class 3. So, but then the issue is when he goes to bed, when he wants to read his story, it's always the toddler story, the hardbound books with the one that, similar to the one that you showed, the fire engine and all. Why is that? When he can do his science, when he can do his history, then why doesn't he graduate to something, some story books of his age?
That's a great question. I don't know if you saw Julie Sandoz speak while she was here. And because she spoke about, I don't know how old Keegan was when this came up. 18, who kept wanting to watch these shows that were called The Wiggles, which was like a child show, over and over and over again, even though he was really capable of much higher level thinking. And he went on to explain, tell me if I'm saying this correctly, that he got stuck in a loop of asking for things that he had been asking for so long, and he was not totally in control of being able to make different selections and different decisions and invite other kind of material into his life. So for your son, this, part of routine, and this is probably the same books he's been reading for quite some time and wants the same things over and over again, it could very well be for him too, that he's stuck in this loop.
But I do get him books of his age. I mean, I do get him storybooks of his age, but he will not read those.
He will
Why
not
is
what?
that? He won't read those. He will go back to those books that he got some 5 years back, but he will not read the ones that I get him.
And have you tried reading them to him?
I have.
And-
I've tried doing that, but not really interested.
What does he do that makes you think he's not really interested?
He'd rather look at the pictures and that's it.
Mm-hmm.
You just look at the pictures. If the books have pictures, fine. If they don't, too many words, not interested.
Okay.
So they'd rather go back to the pictures that those toddler books have.
Okay. So, without asking more questions or really observing this myself, I'm just going to, from what I've gathered so far, it still could be ways that he's very familiar with the books that he's always going to, and that there's a comfort in that for him. There's a repetition in that for him. He clearly likes the pictures. You might try doing in very small steps, like maybe just bringing in one picture and forget having text, but just talking about it. Just telling him about something based on one picture. So he's just developing an ability to attend to that for a short period of time, and then he goes back to his books, right? And then maybe the next day you bring one or two pictures, and if the text is intimidating for him or overwhelming, forget the text, just print out a picture from the internet to just discuss a topic that might be interesting for him, to help him be willing to be exposed to new ideas. But then he still can have the other books if he wants to. That will give him a chance to become familiar with and be more comfortable with different kinds of content slowly over time.
Thank you. Thank you.
Thank you. Perhaps the last question for Dr. Kavita. Dr. Kavita, what is the techniques you follow for a child in an early intervention who has serious behavior issues to make them social with others?
That's a very good question, but a very broad question. So I'm going to try. But the disclaimer that I'm making right now, it's not about technique. There is no singular technique which in the context of that time can help you. So to say I have this magic pill, I don't, neither does the team. So the first thing is to understand the context in which the child is and what they're doing. We find much of the time that this behavior issue, or whatever it is called, is actually communicative. There is an intent behind it. Or it is sensory, the child is uncomfortable, or is feeling something unpleasant. So you've got to be a detective, you've got to try and figure out what the possible inferences of that manifest really could be. Put them into action, work on those inferences, review. If it worked, you now have a list of things that is causing that manifest in the child, and if it doesn't work, you have to make another inference. So, and then review your inference and keep going back to build the skill that can help them communicate it in a different way, not in that way. The only underlying foundation is maintain safety at that point in time, because in that age that we are talking about, the child should not be and ought not to be responsible for their own safety. The adults have to look out for the safety of the child. So that's the only disclaimer. Make sure that they're not hurting themselves in a way. I often find at that age that we overlook the simple things that we take for granted with other children who can communicate. For example, a toothache. For example, having just simple colic. Sometimes growing pains in the calves. And these things, because our children cannot talk about them or communicate them, sometimes we are not able. So if the parent can help us identify the pattern, usually we'll find an answer.
Yeah, if you analyze, I think lack of communication is because when I was in UK, the speech and language therapists were concentrating on behavior management, not only the psychologists, because communication is a major issue with autism. So we just have about 7 seconds. So any other comments? We can, yes, please, if you can be really quick.
Specific question. The findings you have shown in biochemical area are very specific. Are these your findings or secondary findings?
I'm sorry. So first of all, I'm not a physician.
Pardon?
I'm not a physician. So I run a nonprofit organization that sponsors research. So there have been no findings that we have, that my organization and our research that we're sponsoring. We are just in the beginning stages of our research. But what I was referring to is research that's available. It's in the medical literature. So these are other researchers. So for instance, Dr. Fine out of the University of Connecticut would be, that's already published. So I'm not sure I understand your question, but.
No, I found that some of the findings you have mentioned in the bracket that it is measurable. So that means we can quantitatively measure these things, these chemicals, during the pathological tests. So I understand that this is the most commendable work that has been done in the area of prevention of autism as well. So definitely when I am back home I will find out their details, but you haven't mentioned any references, you haven't given any references, so I will consider that this is your organization's own findings.
So they're not scientific findings. The anecdotal cases that I was presenting to you, they're just anecdotes and they're stories. So our purpose is to bring the stories to science. In other words, if the stories exist, that means that there's more work to be done. There's more research that needs to be done. So I'm not sure if that answers your question, but the stories that I shared and the ones that we have on our website, they're anecdotes. So.
Okay, we will try to find out the references.
Sorry, just wanted to emphasize, we have a session tomorrow. There's a full dedicated panel discussion session where you'll get all of them, all the professionals who have presented. And because of the brevity of time, this was just a mini question and answer session. It can be taken up tomorrow as well. Okay. So thank you very much. Thank you to all of you.